go to the level that you, if you're a family cook. But do you do?
Yeah, I cook meals, and then I've got them for 2 or 3 meals, or I put them in the freezer or whatever. But no,
Oh, you're good. Yeah.
Because I enjoy cooking and I enjoy my food. So I do cook. Yeah.
We got in the background. We've got Lisa in the background there. I see you're floating around, Lisa.
How you doing? You all right?
Yeah, nice to see you. Nice. Well, hear your voice. How you doing? You all right?
Yeah, good. Yeah, all good. Yeah, I couldn't make it the last couple of sessions, but I caught the last case study on the sort of playback stuff on the blog.
Yeah.
Good. It was a really long one because I watched about the first hour and I went, "There's another half an hour of this yet."
Well,
yeah, it's good.
The reality was that we went off at a tendon. You start somewhere and then discussion takes you off, and then you kind of find yourself in a different place and whatever you do, and anyway, it was fun. It was good fun. It's good fun. It's good to have something to focus on, isn't it, and to think about.
I don't think I'd been aware of these, or possibly I had, but because a lot of your Thursday evenings haven't included reflexology when you were open, I kind of half dismissed it, and then I read this a bit more and realised that it was a case study and everything, and lovely Annette was going to be there. I thought I'll have to come and see what it's all about.
Yeah, it's interesting, isn't it? It's interesting you bring that up, Michelle, because you're absolutely right. The Thursday evenings have been kind of massage sports orientated for some time. I get that, and it's interesting, isn't it? Because in this crazy time that we're in now, actually there are some interesting twists and turns and benefits, and I think probably this is one of them. We wanted to sort of have a place where we carried on with Thursdays in some format. It doesn't suit some people like it, some people obviously don't, and that's fine. But to have a place where we can just see other fellow therapists and think together a little bit about this place that we're in, and have a bit of fun along the way. And Annette did you did a quiz with us, didn't you? I don't know, 2 or 3 weeks ago, whatever it was, which was daft and a bit silly, but it's about having why not, and people's choice. We'll wait a few minutes and just see who other people kind of join us.
We've got people waiting to join. It says guests waiting to join view lobby.
Okay, so if you
shall I do that?
Yeah, if you press join.
I must say the Association of Reflexologists have been absolutely brilliant. Are you a member, Annette?
I was. I'm not. But I'm not active with them at the moment. But they are amazing.
They've been. We've been having twice a week. They've been sending us videos for hand reflexology. They've started up a book club twice a week. We speak to authors of reflexology books and question and answer. There's coffee mornings, so we get to speak to about 20 other reflexologists. So
amazing.
It's really
that's impressive.
They're so good. They are amazing because they give so much support, and it's well worth joining them, definitely.
Sally who runs it, or part of it, is she's lovely.
Oh, Sally Earlham.
Yes,
she was running the coffee morning this morning.
So
the other morning.
No, she's lovely. She's a goodie. Okay, so I mean, should we hand this over to you, Annette? I mean, we have a little chat about Elizabeth.
Oh yes, right. Okay, I need to get my little spiel of Elizabeth.
And I suppose that presumably we've had a bit of a read. We understand who Elizabeth is. I'm going to call her Liz rather than Elizabeth.
I don't know why I thought
royal
Elizabeth.
now. That sounds royal.
Does it? Yeah, but
yes.
Yeah.
I'm
Okay.
not intimidated by Liz.
So we know she's IBS lady. Okay. She's obviously been fully investigated. She's not got anything seriously underlying. She has alternating constipation, diarrhea, and flatulence. Unfortunately, bloating and feeling very generally sluggish. Symptoms are made worse by stress. Admits that due to job demand, she often skips her meals, resorts to ready prepared ones. Her job is mainly desk centred. She suffers a lot from neck pain and headaches. She also suffers from sensitive skin. Psychologically, she feels down and has become less sociable of late. Haven't we all?
Yeah.
That's true.
Okay, so what do you think then? What's your thoughts? You got anything that you?
I've only had a very brief look at it, so apologies. I've been running around trying to cram stuff in, and shopping now takes twice as long as ordinarily it does. But yeah, obviously I trained in holistic before doing sports, which I've not quite yet completed. I'm not far off. So from a more holistic level, I think it's to try and use massage to reduce her stress levels will help her overall. Obviously, being in mind of a sensitive skin, and using perhaps something oil based that's not going to aggravate her skin condition, and also whether she's happy with abdominal massage in respect of the IBS, and then more generally trying to, I mean, from a sports perspective, you try and sort of correct the posture a little bit in terms of poor posture sitting at a desk but either way, or from a holistic point of view, just trying to ease the muscles that are going to be particularly tight in the neck, upper traps and things like this, and just trying to overall, I suppose, help relax her, which seems to be a lot of the issues, and could even be. I want to know a little bit more about her sensitive skin, whether that's all part and parcel of maybe stress-related stuff. Make sure she didn't have any other allergies. But those were my sort of initial thoughts, really. It's obviously, if she could calm her body down, that would probably assist. You're just not going to get rid of it. It would assist with the IBS. Obviously, a diet, and that's difficult. We're all guilty of that, aren't we? Rushing around generally. I've eaten so much better at the moment because I've had more time and slept better and everything else, and exercised better, actually. But and that is difficult because you're then asking somebody to change their lifestyle and look at it, holistically, like from every angle, and try and encourage you to eat better food, really, in more regular times, little and often, and so it's going to take, it's looking at everything, I guess, but obviously bit by bit, and talking to her, and what does she want out of it? What is she hoping to gain? What's her history? Has she had any massage before? But I've talked too long now, so I'm going to be quiet.
No, that's all good. All good stuff.
You set the stage.
Anything? Yeah. Sorry, Chris.
I would say my first question to her would be, when did the IBS start and what was happening in your life at the time? Trying to look for some kind of triggers, and also looking around periods. Are they regular? Has she had a thyroid test? I'm looking at possibly there being some kind of a hormone imbalance, which is actually causing will cause the IBS, will cause the skin problems possibly as well. So looking at it all tied in together. So that would be one thing I'd be looking at. Yeah.
Okay.
As a massage therapist, whether like more sort of holistic and aromatherapy, would you ask those kind of questions on the first assessment or the first meeting or the first treatment you would have with her? Those are quite personal questions. How often is your period? I mean, I'm not sure. It sounds quite personal to me. Would you ask those questions on the very first time you met the client?
Yeah.
I would personally. Hello, Mark.
Yeah.
Hi, Alisa. How's it going?
Yeah, not bad, you?
Yeah, not too bad, thanks. Okay.
Albeit, I think it's probably easier though, Mark, thinking about it. If it's female to female, it's probably less. Do you know what I mean? All jokes aside, I think sometimes less.
Maybe just as a guy, I kind of picked up on that more than the females.
I think often with something like reflexology, I'm sure you find this, Nikki, that you don't sometimes like cover everything in the first session anyway, and people unravel, don't they, the more treatments that you do with them. So it doesn't mean that they give you all the information in the first go, because it can bombard you as a therapist, can't it, as well? So I tend to try and take it gradually with them, and over a period of time, you'll find more comes out.
I always think if somebody's had a long history of something and doctors quite often can't find a cause for it, there's usually something that's happened in their life, whether, you know, some trauma, they've lost somebody. There's usually something that you know has put her in this position, kind of thing. I find.
Yeah, I think you're right.
Are there? I don't know much about. Does anybody out? We've got a couple of people listening in here. Does anybody know much about IBS? What, you know, that are there? I mean, you're suggesting, Michelle, that sorry, Nikki, that there's sometimes a trigger. Sorry, forgive me. You're suggesting, is there a trigger with IBS? Is there just something where you don't have it for a period and then something happens, like you're suggesting a potential trauma or a loss or whatever? I don't know. Does anybody know? Does anybody have any suggestions on IBS?
I have a friend who has IBS, and she has issues with a family member which cause extreme stress, which really sets her off. And she has gone to somewhere to get a FODMAP plan. Anybody heard of FODMAP?
Yeah.
No.
Yeah, so you extract things out of your diet, like onions and garlic, which trigger irritable bowel syndrome, etc., and then you reintroduce them. But yeah, I think stress is a good trigger, can be a trigger.
Yeah, and food, different foods as well can set it as well, can't they? Like you say, those type of foods are really classic in setting off IBS. Yeah. So, what about reducing stress? You know, what could we think about in terms of reducing stress?
That looks like a quite a kind of important theme here, isn't it? It was like one of those cycles where this causes this, that makes you feel stressed, that drives you to not be kind of self-respectful, and you end up in this circle of going round and round and round, I guess, and stress being an underpinning of that. It's a good question.
I'd certainly try and encourage her to take a bit of daily exercise. Now she's busy, you know, it could literally just be like 10 minutes walk outside, just something very small that she could manage to do, like maybe every other day or a few times a week, but definitely I think that would help with her stress levels, and may help with other things as well. You know, psychologically she feels down, has become less sociable of late, just by getting out. You know, if there's a park or she's able to get out in nature somewhere, I think that would really help.
I might ask her a bit about her hobbies, understand her a bit more. You know, she might, like, as you say, Mark, she might enjoy going out and being part of that kind of getting out and walking. And
but if she doesn't,
might involve, you know, she might have all sorts of hobbies that, you know, we don't know about, which you know, hobbies are good, aren't they? They make us feel comfortable and make us feel kind of that we belong to something, you know, be it a reading club or doesn't matter, whatever it is, doesn't it? It could be whatever. You know, to be part of a group doing something is gardening clubs and whatever, you know, they're great places for people to feel, you know, part of something.
When you do massage and you meet people for the first time, would that not be part of your assessment process, that you would ask about what they do for exercise, what they do for relaxation? Is that not part of your thing anyway?
Yeah, you do go through a consultation process, and probably modified, you know, the consultation forms to how it works best for them. But yeah, I think, like we said at the beginning, I think when you build that relationship with somebody and get to know them, although I've had people that I've never met before on the first occasion literally tell me their life history, you know, and you're like, dear God, I don't think I'm qualified to listen to this, but okay. But yeah, but I think, as I say, when I don't know what other people have found, you get a form and people fill it out, and however simplified you try and make it, because I hate forms myself, you get it back, then you start going through it, and loads of stuff comes out that they haven't even thought to mention. Sometimes there's a heart condition, which is mildly disturbing, but you think that they've had this condition for so long, well medicated, completely forgot about it, you know. Anyway, but yeah, it just depends on the person, I guess. But if they're quite down anyway and they're not used to you know, maybe if they have withdrawn themselves from people, they might find it a little bit difficult to open up, I guess.
Yeah.
But also I'm thinking widely whether it's worth thinking about signposting to, you know, if they really are down and they present as quite, you know, I'm not qualified in that, but we can all tell when friends are perhaps sort of a little bit down, and especially the minute that things are dragging them down. I always think it's worth mentioning things like, you know, the Let's Talk service and things like that, or like Headspace app, because we've had a massive push at work with all this and sort of trauma-based therapies and things and access to it all. But it might be, you know, it's difficult to project it until you talk to somebody, but they might actually disclose something that happened to them, or, you know, it could be a bereavement, could be anything, couldn't it? But it's worth having that thing in the back of your mind, because obviously then if you've seen them, you've got a sort of duty of care, and then they go off and perhaps get worse. I don't know. But I always think it's worth maybe mentioning that to people and making a note of it. They're quite
It's
down.
interesting that you say about they don't reveal. I think that's the theme of reflexology, isn't it? People don't reveal, and things come up in their feet, don't they? And then they go, oh yeah, I forgot, you didn't mention that, I forgot that. Oh yeah, and so it can be, you know, the feet don't lie, do they? That's the thing. Things come up, they will come out in the feet. But even looking at people's feet, isn't it, is interesting when you look at the colours of people's feet, and you use, you know, they're really red, they're really stressed, you know, so that you can do an assessment of the person by looking at their feet, and they tell you a lot, don't they?
So in terms of reflexology, I mean this is, as you all know, this is not my thing, but where would you, if you've given that scenario for somebody and one of the plugs seemed to be stress and feeling overwhelmed, plus this kind of bowel issue that is kind of not wanting to go away, and there's a cycle going on somewhere. Talk to me, Nikki. Tell me reflexology.
The first treatment, I'm all over general treatment, but I would focus on the digestion areas and probably the head and neck as well. And hopefully, depending on the person, because not everybody does, will switch off and relax in itself by showing them that their body can relax. What I often say to people is, right, you've been able to do that. Now we need to look at ways that you can do that for yourself and get yourself into that space. So depending on discussions you've had with them, whether their thing might be meditation, whether it might be yoga, I would certainly always discuss breathing techniques with people, because that always is the thing to calm them down. And then I would also show them some points on the hand for hand reflexology that they can, you know, do when they feel it bubbling up, that they can actually, you know, calm it down again, really. So yeah, that's kind of
what are the hormones around stress? If you know somebody's stressed, I get the diet, I get the kind of digestive system. I kind of understand that in my simple way. But if you've got somebody who's very stressed, how do you approach that?
In what? How do I approach it, or how do I be with their adrenal glands and the cortisol levels, and because that's in effect what you're trying to calm down. So, you know, when they're getting very stressed, they're getting the fight or flight, and they're triggering off all those things, which is probably that's what's doing their digestion, because your body is getting ready to fight that tiger, and it's getting rid of all the digestive things because it doesn't need it when you're fighting a tiger. So you need to calm that down. So you need to calm down the adrenal glands.
Yeah, absolutely. And that's such a good point to know on the hand, isn't it? The adrenal points on the hands are so handy to know. And people feel, I often say people feel a bit empowered when they know those, because they can go on them themselves, can't they? They can do a bit of manipulation on the points, and it can be a little bit empowering for them.
Yeah, absolutely. And they can do it when they're feeling anxious, and nobody else needs to know that they're just sort of rubbing their hands together.
Yeah.
Can I just, because I don't have much knowledge of reflexology, I don't have any knowledge, to be honest, but it's really interesting to me that obviously I know that certain points on the foot relate to certain places in the body and organs and things. So with the hands, is that something sort of in addition, or are there actually separate points on the hands that aren't on the feet? I know that sounds really ignorant, but I genuinely don't know. But it's interests me, so
Okay, who wants to answer that one?
It's exactly the same on your hands as the feet. So the hands have another whole map on them as the feet, and the face does, and the ears do as well.
Wow, honestly, I genuinely had no idea.
I haven't gone into the ears yet. I do face, but I don't do ears.
Wow.
Yeah, no, it is fascinating. Yeah. You'll have to go and have a treatment.
Yeah, absolutely. Yeah, come into college. Come have a treatment.
Yeah, I don't know if anyone wants to expose to my feet, to be honest, but yeah.
Oh, people always say that.
Fine, it's fine. Everyone's feet are fine.
So would you treat both feet or one foot at a time, or? We treat both.
We treat both feet, but it depends on who, on the reflexology that you do. But generally we treat one and then the other, but sometimes we might toggle between the two. So, it depends on the reflexology that you do in terms of routine and what you're taught. So, but yeah.
Cool. Thank you.
Are there any aromatherapists here?
Yes, me.
Who's that? Oh.
Yeah.
Can't see you. Where are you?
Aren't I there? Oh, what do I need to do?
Oh, hello. I can see that. I can see you now. I was there. Obviously, we're applying this to reflexology. I just wondered if you had any thoughts around essential oils. Sorry to put you on the spot, but if you had any, thoughts about essential oils that would be good, bearing in mind she has sensitive skin.
Yes. Well, I don't know if there is anyone else there that does aromatherapy, but I have just changed my oils over to a company called doTERRA, and they've had a lot of flash. But actually, I think the oils that they have are actually quite brilliant.
Yeah.
Really.
Yeah. I think the quality of the oils is amazing. I have to say.
Yeah. I mean, they're expensive, but for the ethos of it all, you can track the oil back to the actual farmer, and the people that are being helped by farming and producing these the quality is lovely.
Yeah, no, I agree. The quality is very good. Yeah.
Yeah. So
Juliet,
so I'm still getting the hang of, because there are so many oils that they do. So I was looking at inflammatory bowel disease, and we all know that lavender and frankincense, well, that was always there anyway. To rub on through the colon system, if you like, the bowel system, and also on the feet, and also use as an inhaler. But I think if there's a lot going on with this lady, I don't think any amount of oil is going to make any difference at all. But that's just my opinion.
It may need a multi-pronged response. It's not just necessarily one thing. It can be lots of different things. Yeah, I agree.
Exactly. So I don't know.
Okay, thank you for that.
Yeah.
What would you do then, Juliet? I mean, how would you? We can't actually see you, so if you pop.
What do I need to do?
I can see you
now.
Yeah, just press the camera button and.
Is that on or off?
That's off.
It's off. But if you fiddle around with it, turn it on.
Is it on? Yeah.
It's on now.
Right, I'll leave it there. I won't fiddle with it. I don't know. I'm sorry, I wasn't here to at the start of the meeting, so I don't know really what quite you discussed. But yeah, I understand that this lady has been to her doctor, and if it was me, I'd like to know a little bit more about that. What he said or she said. Has she had any investigation? Is there a history of it? And And has she had any treatments for it yet? That would be where I would start anyway.
Okay, so with the GP's underpinning knowledge, you would work with that.
Well, I would want to know what the GP actually said. Has she been for any investigation?
Yeah. Okay.
Has she got IBS, or has she got Crohn's disease, or has she got anything else? And I think the only way to label something like that is to go and have investigation.
Yeah, sure.
And I before anybody would treat that person, because you want the whole picture before you start, really. I wouldn't go ahead with doing anything like that, I don't think, not knowing if I was doing any untold damage. I don't know. That's just my opinion, but you know. I don't know. What does everybody else think? Sorry, I wasn't there, but
I think the more information, the better. Absolutely, because then you can get a full picture of what's going on and think of different ways to help. And it'd be useful to know if she's tried to tackle it herself, in a different way, or what, like you say, what like Juliet said, what other treatments she tried, or she might be on the herbal stuff. I know Chris loves that. So she might be on some kind of herbal treatment. But she might try all kinds of
trying to
things.
say, Lisa.
She might have tried nothing at all, but it'd be interesting to see, she's never been on any medication, whether it's sort of off the count, it's a prescription or otherwise.
If you go to the NHS, if you go to the NHS advice for IBS, it says it does mention about that, and also it says peppermint tea. It does say about the FODMAP, and it says about things like CBT and things like that. So
what's the FODMAP again, Annette? Sorry.
It's a diet that takes out known triggers for IBS, so things like onions, garlic, cabbage, that type of stuff, and
it's
then
things are fermentable, isn't it?
Sorry, say again.
Fermentable.
Yes, fermentables. Yeah, absolutely. Yeah.
And things like like leeks and spring onions. You only eat the green part. You only eat the bit that comes out of the ground. And then there's the other thing to do with eating is she intolerant? I mean, when you think about IBS, you think about wheat and gluten, don't you? I only know this because I was diagnosed nearly 40 years ago with wheat and gluten intolerance, and that's the first thing that they generally take out of your diet, because it's a factor that they do cause problems.
And it would affect her skin as well.
Yeah, definitely.
Yeah, the whole body, because it causes inflammation everywhere. So, and that's what you don't want, isn't it? You know.
The other thing they mentioned is avoiding sweeteners. That was the other thing. They mentioned sorbitol as one of mentioning avoiding sorbitol.
Because if you've been banned in America, but they're still on the market here, it's don't know. Know about that.
I suppose from a reflexology point of view or aromatherapist point of view, it's about, given this scenario, okay, there's some more detail to get at, and there's more underlying issues that we might need to get hold of and be part of. But I suppose the game plan of this kind of idea of playing with it is that we haven't got all the answers, we haven't got enough detail, but can we put a treatment together? And if we did, what would it be? And Nikki, you were sort of playing with that idea of reducing the stress in the system and also working on the digestive issues. And it's just interesting to play with that, isn't it? About the crunch question for me always in my kind of teaching room is about, where do we start our treatment and why? Now, I don't know if you can transfer that to reflexology. I don't know, because I just don't know. Annette, you can help me. But you know what I mean? That's Lisa's sitting there. My question with Lisa would be, right, this lady's coming with a bad neck. Why would you massage that area, and what would you do? And it would be about justifying your kind of thinking around, do you just rub her neck because she's got a sore neck and back and shoulders, or are you thinking something different?
Yeah.
And if you're thinking differently, why are you thinking differently?
Yeah.
And that's, I suppose, the kind of teasing out bit for me. With reflexology, I guess that if you went to 5 different you tell me if I'm wrong here, if I went to 5 different reflexologists, would I get a different treatment in each 5 of them? If I had
you wouldn't, you would get a different routine, but we would still be probably all hitting, you know, similar reflex points, but the routines are different, but the actual reflex points are, you know, pretty much standard. But we would always, with reflexology, although they may well come in with IBS, you're still going to give an all-over treatment, because an all-over treatment works best anyway. And we would revisit, as Nikki said earlier, we'd revisit the bits we need to. So we would go back and concentrate on what we need to. But a general treatment helps to clear off blocked energy through the whole body, because it might, you know, it could be in other areas. It may not just be sat in the digestive area. So we clear the whole body and revisit where we need to.
Yeah, one of the things
we would want to encourage them to cover a block of treatments, really, so that, you know, I always try and suggest to them that, you know, it's not going to be a quick fix, especially if it's something they've had for a long time. And like going to the gym, you don't get your 6-pack after the first time, so we need to build on it. So I usually try to see if they will commit to coming to perhaps 4 or 6 treatments with me, perhaps initially fortnightly. It's always difficult because you feel like you're trying to sell them something, because obviously you want the money. But you know, it's usually the case. You know, if they've had a long-standing problem, they do need to come.
Yeah, they need to come initially. Every year they've had it. Yeah, they need 1 treatment, don't they? So it could be 20 years and 20 treatments. So yeah, and also they may well.
Is Liz coming to you, massage therapist or reflexologist, and expecting you to solve all of her problems? And do you give her, you know, what do you give her to assure her that you will do your best to solve them? Or would you say, yes, I can do a little bit as a reflexologist, and, you know, I'll send you to my friend who's a massage therapist for more detailed work on your neck? I don't know, how expectant, not being a holistic therapist yet, how expectant are case studies like this, or people, clients who come to you wanting you to solve their problems?
Good question. That is a good question.
What do people think?
I think that if I think in the case study, obviously she's very stressed and got neck problems, but as we all know, that it may not be the neck, somewhere else. And I would think that for this lady, I think she needs to go the whole hog and have massage, reflexology, aromatherapy, and whatever else, because I think she needs to relax. And yeah, I think if I was going to attack it that way, I think that's what I would recommend to her, saying, well, I don't know what's going to work for you, so we'll start with a massage, and then we'll go with reflexology, and then we'll go maybe aromatherapy. I don't know.
Would you roll that? Would you talk about that with her like you have now just now? Would that be your kind of, look, this is my thinking of your case, your situation, what you presented me with?
Because I think whatever, you never know what's going to work for someone, do you? I get that a lot. I don't know.
It's interesting.
Would be my thinking to give it all a shot, really, to see what happens.
Yeah.
I would come away from the idea and wouldn't want them to think that they'd come to me for me to solve their problems.
No,
I put it back to them that it is their body.
That's what I mean.
We are facilitating things, and that you know, they may need other modalities as well. But often I find after a couple of treatments, they often feel more empowered and more motivated to
Absolutely.
actually want to start the diet or go running or whatever it is that they haven't felt like they've been in a vicious circle before, kind of thing. So I think any treatment can sometimes produce that, can't it?
Absolutely. And people often come with recommendations, don't they? They'll come because they've been recommended, oh, this, I've heard you're great, and I'd love to give this a go. I mean, I wouldn't tell them I would solve their problem. Absolutely not. I would, I'd say reflexology can certainly support, but I can't solve the problem. We certainly give 4 treatments a go and see how you get on and review it. And most of the time, I have to say, with IBS, it works really well.
What worries me most, I think, is that this lady, there's no definite label. So it's like, are you helping her with a cause, or are you helping the symptoms? And I'd rather be looking at the cause first of all, and see what it is, and then going from there. I don't know. That's my thought.
Having had the treatments at the academy from the students, it's always really nice to, because I hadn't had reflexology before, it's really nice the way that you talk us through the treatment, and is this area a little bit tender? That's because of X, Y, and Z. It could be this. You could help yourself by doing X, Y, and Z. And so I think just after that initial treatment, she'd go away thinking that she's a little bit more educated on her body and on the treatment, and she could make her own decisions based on what you've educated her on.
Yeah, absolutely. But we have to remember as well, if it's a first treatment with reflexology, and Nick, you'll agree with me on this one, that sometimes they can get a negative reaction following a first treatment. But it actually, for me, I do tell them that and say, look, it's a good thing, because it means your body is responding to this treatment beautifully. So you are clearing something off. The energy you are clearing it off. It's a really good thing. You won't have that on the next treatment you have. So see it as a positive rather than negative.
Yeah, I mean, in reflexology, would you work on the intestinal colon area? Would you spend time on there?
We would revisit. We always do a whole treatment, and then we'd just go back and revisit. It works better that way. Otherwise, if it's piecemeal treatments, they don't really work as well as if doing a whole general treatment. So
no, I know.
I think it's always interesting when we have clients who bring in, this is a fairly distressed person who's coming in with a whole series of different things happening for her. And as therapists, our job is to sort of contain that and offer her a place where she can offload, some of which we are skilled to work with and some of which isn't our stuff. And we would refer that back to the GP or off to other specialists or dietitians or whoever else. But our job is about not necessarily coming up with the answers, but our job is about offering a safe place where this lady, in this case, feels kind of looked after and listened to and given a place where she can tell us where she's at. And then from there, we can do our skills, because that's what we're good at. Or we can refer off and think, well, I'm not sure. Why don't we put that thought in your head and we'll ponder that one as we go. And try not to get into that place where, if I were you, I don't know, if I were you, I wouldn't. So we offer that place where we contain people and look after people in a safe place, rather than reflect, well, I wouldn't deal with that. That's not my thing. Gosh, we can be reactive, and we have a lot of this in the BBC at the moment, don't we? With our lovely coverage of our wonderful virus that we're living with. Sorry, I had to throw that in as my standpoint. And the world we live in.
And sometimes with reflexology, you do have to be careful. People do come and they look for answers with you. They may well say, "Oh, can you tell me, if I got a thyroid problem? Can you find something in my thyroid?" No, can't. We're not here to diagnose a thyroid problem. You need to go back to your GP. If you're worried about your thyroid, go and see your GP. So you've got to be careful of that as well.
Yes, because people like to have something, don't they, that they can say, "Oh yes, I know what it is now," and it's a relief that someone else has confirmed maybe what they were thinking or something like that. But this lady, I noticed that she doesn't get to eat properly, and that's obviously again a big issue, isn't it?
Yeah,
a really big issue.
Yeah,
I think. So yeah, and if she can't eat properly, then maybe just eat twice a day. And there is this big thing about fasting. If you've got stomach problems, you cut down your meals or have smaller meals or just eat throughout the day, but small things. But you know, and what are they eating? You know, what do they have? You know, that might be the roots of her problem, but
yeah, we don't know, do we?
We don't know.
We don't know. No. But yeah, but I was I think we were having a discussion with Nikki at the beginning, saying about you making meals in a quantity, and maybe she could do that on a weekend so that she's got some stuff in the freezer, so she's not having to eat processed food. So about being a bit, maybe a little bit more organised on the weekend if she's got the time.
It's a lovely example, isn't it, this case study of the terribly complex integration of our emotional states and our physical states. You know, our self-worth and our feeling of depression, coupled with pain and digestion, coupled with skin and out. You know, she's a lovely example of that kind of inside and outside becoming muddled and overwhelming. And for us, I think it's a real skill when you have these people come into your treatment rooms to think about how we help contain that and think about that. I'll come back to that again because it's a big thing. You know, sometimes it's just about listening, isn't it, and providing a safe place where we can review where we are, and stick to our game plan. You know, our skills are reflexology. Our skills is working through the. I want to know about where you would start your treatment. Actually, that's what I want to know. I want to know a bit more about this reflexology stuff. What would you start? Can you tell us? I don't know. I know where I would start with her if she came in with her neck and her bow. I've got an idea what I would do.
We don't approach it like that, Chris. It's not like that. You have a routine. You
have a routine. You would have a routine like the one that Annette taught me, and you would do that. But as we said, you would perhaps focus a bit more on the digestion area or the head and neck, or in fact any other areas that came up while you were treating. You would perhaps spend a little bit longer on those, or you would go back to those, and just because they can indicate that is where the imbalance is, even though she's not feeling the imbalance there. So you would just do an all over.
Yeah, no, I understand that.
Yeah, yes, as you say, Annette, we come at it differently.
Yeah. We don't have these tests and things like that. No postural assessments. Actually, we do look at the feet, though, don't we? We do look at the feet. That's so interesting. In reflexology, we assess the feet in the way they fall. So we would look to see for inversion, pronation, things like that, because that has a massive effect on things like the skeletal imbalance in reflexology. That will come out in their reflexes in their skeletal system. So there is something of.
And if you've done a foot reading course, which I haven't done, but I saw Sam Belaya, who's in a book, and it's just absolutely incredible how, you know, a little crease here or a little thing there can tell you so much about a person and, you know, their lives. It's incredible.
Yeah. Always blows me away that you can tell so much by looking at the feet even before you're doing a treatment.
Yeah. So it's truly holistic in that way, isn't it? That containment is lovely. Yeah. Has anybody got any other thoughts around the sort of reflexology or aromatherapy aspect of this? I don't know who else is sitting in the background. Who is? Are there any other reflexologists floating? Is that the expression I could use? I don't know. Do reflexologists float? I don't know. I think they could do tonight. I don't know.
Can do, yeah.
They can.
The right energy.
I feel like it. I do, yeah.
May I ask, whatever therapy you were giving, if you had Reiki as one of your skills, shall we say, would you consider offering that, or would you just give them a sneaky shot of Reiki while you were doing a bit of reflexology, for example?
No, well, no. No, it's. I have to say, if you are tuned to Reiki, it comes through no matter what. It will make your treatment stronger. I do think that reflexology Reiki work really well together. I wouldn't do it without asking permission, as in giving a treatment, but the actual, I can't help it. It comes through. It makes the reflexology stronger. It's just, yeah, for me it definitely does. So yeah, so. Yeah, people are really interested in Reiki. You should, if you say you do Reiki, they'll say, "Oh, give me a little bit," and things. So yeah.
I've had some clients who have asked me after the treatment, "Did you give me some Reiki then?" And I haven't intended to, but it comes through if they know about it. Yeah.
What would you do, Michelle? What are your thoughts?
I think it would be quite nice to, if you had that to offer, because that's just a general all-around healing, isn't it? And it will hit the right area that needs to be. Yeah. It will go where it needs to go. Yeah. For the greater good.
Also, Michelle, it protects you. It's like a little protective bubble for you, so that when you do a treatment, you can give yourself a little Reiki shower. And it gives you a little protection bubble, because you can feel energy. If you're attuned to Reiki, you can feel energies. So and sometimes people that are going through a lot, it can make you feel a bit, a little bit not uncomfortable, but you can shake it. I shake a little bit if the energies are a bit, if they're going through a lot. I can find myself, so I try and do a bit of a Reiki shower and sort of imagine myself chained to the earth. Chris is like going, "Oh my God, I can just see."
You've got no idea what Chris is doing.
What Chris is doing up again. But so I imagine myself with a big rope around my waist, sort of chained down into the earth. So yeah, so I find that helps me. So because you can take on, you can take it on a little bit.
Thank you.
This lady needs all the help she can get, doesn't she? And doing some of that kind of grounding, kind of energetic work with her will be really supportive, I guess. Of course it would. It would be, bless her. She's in a hard place, isn't she? Where it's all going on for her. So the more you can offer that kind of, you're absolutely right. That Reiki going to the places where it's needed it's so important, isn't it? And so it's lovely and benign. It does the job. Great.
Yeah. Also, things like mindfulness, yoga, meditation, all that's, that's all easy. You can get hold of that really easy now, can't you, on YouTube and things, and so that's really helpful, isn't it? So I'm sure with lockdown, I think we're all getting into that, aren't we? Doing bits and pieces, and I found meditation really really useful, actually.
Yeah, meditation definitely.
Did we explore more about the massage side of it? Did we talk about the ache and pain side? Have we sort of?
Yeah, we're just going to fuss over baby now, I think.
Sorry.
No, I don't apologise. It's fine.
Sorry.
You look preoccupied there, sir.
Hello. Can you hear me?
Yes.
You're a little bit dark.
Yeah.
You might want to turn the light on.
Well, she's feeding babies,
Wake the baby up. The baby's just dropped off after 10 hours or something.
Sorry.
Big bright light.
I thought people couldn't hear me because I've got headphone connection, so I've just been sat listening.
No, you can hear you. It's good.
Sorry, did we explore the side of the neck and the backache? Did we look at that in terms of what we could do? Massage, sports massage.
Yeah, I mean, I can attack it from both points, really. And I think, because Chris always says, don't focus on the bits that hurt, look at why it hurts and what's causing it. I think when I was just doing holistic stuff, I think you would gravitate more towards easing those tight muscles. But now I know a bit more about posture. you'd look at, if they're quite rounded, sort of shouldered or neck forward, you'd look at sort of opening up the chest more, and and just looking, I say, do a few sort of range of movement tests and see more specifically what the problem is. But very basically, you can guarantee that the pec muscles will be tight, need loosing off. Levator scap is probably a bit tight and causing some issues. It'd be interesting to see actually if you get headaches on top of everything else as well.
Yeah, I think she did.
Yeah, so you'd be looking at all the usual sort of suspects and upper traps and things like this. Maybe rhomboids are a bit tight, or even actually got a bit weak because of the hunching over and needs strengthening up. But that bit's a bit on me because I didn't know the basic course. But I'm thinking, at some point, loosen off the stuff here, and then you'd probably be wanting to strengthen the back a bit just to sort of hold that sort of posture back a bit. So yeah, and obviously you kind of, as you sort of make it, you might find stuff that she didn't know about, and then you hone in on and go, and that won't be helping either, and then work on that, and obviously work on the deltoids and things like that, anterior deltoid. But yeah, as you go through, as I say, the bit that's hurting, it's not generally the cause of it; it's just the resulting factor for poor posture and things like that. So yeah, a bit of that, I guess.
That sounds good.
I thought it'd be quite nice to start with the head and the face. If she's quite stressed, that's quite a nice, simple way. And you can, I know we've talked a lot about empowerment throughout. You can show her simple techniques at home just to relieve a bit of stress, because you hold a lot of stress in your face, don't you? Just here and here. And I thought working up and down the erector spinae might be quite nice because of all the nerve pathways going off. And with her IBS, she'll be inflamed in many places. So just kind of switching all them on, I thought might be quite nice. And then again in the lumbar area, because if she's inflamed here, it will be affecting there as well. And I guess it depends as well if she, because sometimes she's constipated, sometimes she's got diarrhea, she might be really tender. I mean, if she'd be up for abdo massage, that would probably be really beneficial. But it might be 1 week she is, and another week she's not because of where she is with that IBS, or with you as a therapist. Like, it might be, sometimes you think the initial treatments, they're like, oh no thank you, and then when you've unraveled them and all got to know them a bit more, they've got a bit more rapport and trust with you, then they do, because it's quite intimate, isn't it? But I guess if we can just advise her as to the benefits of it and give her the choice, it might be really good. But if she's got a massive flare up at that time, it probably wouldn't be good, because you don't want to be poking around. But you could still do the lower back, which hopefully will have some relief for her into the front. I don't know.
Yeah, that's true. Because I just think if you're getting stomach cramps with it as well, you might be hunched over even more if you're not. I mean, I know when I've had period pain in the past, you can't help but hunch over. It's like not great, but yeah. So it would probably be making the lower back ache as well anyway from doing that. From getting stomach cramps and things. So
has anybody got hot stones?
Shout,
has anybody got hot stones? Anybody got hot stone? Anybody trained in hot stones? Because that's wonderful for tummy massage and IBS. If using hot stones is wonderful.
I guess even stuff like if they didn't want a stomach massage but were quite happy with their back and everywhere else being worked, just laying on a warm blanket, because they would be obviously laying prone. So on a warm blanket might, if you've got access to that, might have some benefit. Even if it's just a bit more relaxing and comforting, it's still a benefit, I guess. I don't know.
I think there's always a challenge, isn't there, when we have somebody who is feeling pretty miserable for much of her time, and to get somebody to start noticing, in this case herself, and noticing the things that would be helpful for her, be that dietary, be that self-massage, be that exercise, be that, you know, finding a way of making herself feel a bit better about herself. You know, how do we start that journey for somebody? How, you know, maybe it can be, you know, just coming to our treatments and having a reflexology treatment. You go away feeling looked after and thought about, and that gives you then the courage to start to eat better or prepare meals or do all the things we've been talking about. And I think it's a really interesting debate, isn't it, about how we take people out of their cycle of injury or cycle of, you know, depression or whatever you want to call it, and offering them kind of ways in which, you know, baby steps to start to make themselves feel better about themselves. It's hard. It's really tough, I think, and
it's often it's change one thing, isn't it? Change one thing, and that can be, you know.
Yeah, that's a good point. And it can be, can't it? It can be just a very small thing, somehow lifts you from a place of feeling quite despairing to a sense of empowerment, and you can take control.
Yeah, I agree.
And that's what our job is, isn't it? Our job is about providing an environment where people can start taking control of their diet or their exercise or whatever it is. Look, I know there's some scrumpy people going on in the background. Who we got? I can see we got Claire's floating around. I saw her floating around, and Hayley, you're floating around somewhere in the background.
Good evening, all.
Good evening to you. How are you doing? Nice to see you.
Not too bad, thank you. Nice to see you too.
You know, sports at Mark, you're still floating around. So, you know, from a sports massage point of view, where would you start your thinking?
Well, it's interesting, sort of, obviously listening to everyone else and the different angles that they come from, and you know, yes, this woman is going to be really tight through the pec, major, minor, through the SCM, and you want to offer a nice lot of opening up there. But you know, considering everything else, I'm sort of thinking about her psoas quite a lot and her diaphragm, and really looking at how she's moving through that area. So I'd be looking to try and do some sort of intercostal diaphragm work, some psoas release, depending on her cycle, and stuff like that with her as well. I think, because that, I think, could give her a lot of relief. You know, some people talk about, you know, read a bit more about the psoas, and the psoas is the muscle of the soul, and it's what connects the top to the bottom. And you know, she sounds like she's in quite a deep place, and it could be one to really kind of connect with her. You know, and if she is up for a bit of abdominal work, you know, she could have, you know, some relief, massage through that area as well, quite happily. So
it's a tricky one, isn't it? I'm really pleased that you brought up psoas. It's a massive emotional muscle release, and I'm really pleased you brought it in. Now, whether or not, given this scenario, you can imagine this area being really sensitive and irritable, and the last thing she wants is to have somebody pressing their fingers in. So whether or not you can do some sort of gradual kind of yoga work or lengthening work or whatever, there's all sorts of ways. But you know, if you're level 4 qualified, then you might just do some straightforward muscle energy technique lengthening, you know, to really open up the psoas and make things feel like you're opening. I think I'm really pleased you brought that in, because it's for me, that will be one of the key muscle groups I'll be working on with this kind of emotional state. The psoas and that whole diaphragmic, absolutely, that whole chain of work through the center there is, and everything you said, Lisa, you know, around that shoulders and protraction and all that stuff, of course, neck work, whatever. But for me, you know, she sits down a lot, she's at a desk a lot. So hip flexors and so are all going to be a fairly important theme to have a you know, reflection on and check where she's at, and range of movement stuff, all the stuff that we do. And but yeah, I'm really pleased you brought that in. That's such a powerful muscle to even you know, you can change people's lives with psoas release. Yeah.
Thank you. No, I agree. You know, the actual physical touch of it can be really quite uncomfortable for some. But for those, if you have got your level 4 and you do the NET work with it, it can be really, really good. So yeah.
I'm really pleased you brought that. That's cool.
Thank you.
Has anybody tried kinesiology at all? I know obviously you talked about muscle energy testing just then, but has anybody had kinesiology?
Yes, I have.
Yes.
I still go. Yeah. Yes. And I do refer a lot of my clients to kinesiologist as well.
Yeah.
Do you guys clap at 8?
Ooh.
Oh
It's
yeah.
really random.
Ooh.
Oh yeah. No, I'm just going to do that quickly.
We do a job clap.
The answer is sometimes we do, and sometimes we don't. Yeah, it's good.
This lady may be needing to utilise the NHS.
Yeah, maybe.
Yeah. Yeah. You were saying, Nick, you use the kinesiologist, don't you?
Yes. No, I've used her, and because I was having, well, I wasn't diagnosed with IBS, but I was having digestive problems, so I didn't go to the GP. I went straight to a kinesiologist, and she found that I was intolerant to loads and loads of things. Some of them were kind of FODMAP and some of them weren't. So onions and garlic originally, but I could eat leeks. So it was a bit strange. I still can't eat garlic. I don't eat gluten. But it has made a huge difference. And I still go to her when I can, about every 6 weeks now, but because she does the energy as well, so it's a nice treatment to have. But if you've never had it and you go, it absolutely blows your mind. It's just unbelievable how they can tell from the muscle testing. It's incredible.
I'm a bit like you. I had a very good experience with it. So, and yeah, I had a bit of a problem a few years ago, but I'm fine now. But it really helped.
Yeah. Now she's had a lot of clients from me as a result.
Yeah.
Do you get commission, Nikki?
Sorry?
Are you getting commission yet?
No, I don't, but I think I get probably £5 off treatments these days that I, when I look at her price list, I'm getting it very slightly cheaper. So it's probably why.
Yeah, it's interesting, isn't it? The whole gut health thing. I mean, it's all like the NHS and sort of allopathic medicine have really seized on it lately, haven't they? Yet, and yet, I think, crikey, we've been saying this for like 20 odd years about having gut health and bad bacteria overgrowth. It causes imbalance in the body. We've said it for years, haven't we? Now they finally have said, actually, yes, there's something in this. So interesting.
Good evening, Wendy. How are you? You in the back and there? I can see that you've come on board.
Been quiet.
All right. That's a familiar story. That's fine. Any other kind of things that we might think about for this lady, or
Chris, just picking up on the psoas and sort of diaphragmatic massage with the stomach conditions, would you be a bit concerned about massaging around there just because it might be a bit of a sensitive area? Would there be an argument for avoiding that area, certainly to start with, or would you kind of sort of dive straight in?
Are you asking me, Mark, directly?
Yeah, or just anyone really.
Yeah. Anybody else got a view on that?
I think as long as there's not a massive flare-up of IBS going on at the time, certainly from when I did holistic for abdominal massage, it helped sort of calm the muscles down and encourage better sort of digestive process. Ilioceus release, I touched on that obviously in my level 3 course with you, and I think other people have said it, that it's had massive benefit if the hip flexor has been really tight and stuff. And it's difficult, isn't it? Because I think it's an exploration, isn't it? And it's one of those things you don't know what's going to help almost sometimes until you explore different areas, and then you find something else that she probably didn't know about and you weren't sure about. And
If
you'd also look at with the neck as also, you'd also look at, like, you know, the pecs and the traps and the deltoid as well, and you probably work on those, and you might work on both those different areas, down on the psoas and up on the upper body as well, opening that chest out. Like you said, Lisa, you know, really working on those pecs, and if she's at a desk, you might be kind of like all hunched over and protracted.
But Mark, sorry, just to go back to what you're asking about the stomach and stuff like that. If you're thinking starting, obviously, fascia down, I don't know what you've got in your toolkit, but if you've got any sort of massage tools, anything like something that looks maybe like an IAM tool or something like that, it looks a bit like a blade, or a gua sha kind of tool, and just sort of feeling for the areas of tension in the fascia and working through those first of all, and seeing how, you know, your clients respond to that before you then start doing some massage with movement, maybe through the rectus or the obliques, and start really sort of handling them more. Maybe just work through the fascia and the areas of adhesions there.
So kind of just exploring first, and not kind of like digging right in and going right.
Yeah,
you know,
just
take a breath in and.
You know, I don't know.
Stuff straight away.
Well, I'm you, Mark, just diving straight.
I think what one of the ladies said about it earlier, but I find that the stomach is probably the most personal area to massage on a woman, because I don't know, there's just so many things about a tummy. I think that, you know, they'd almost let you touch your bum all day long, but your tummy is quite different. So, you know, start off gentle and just feel the way around and find those areas, and even just relieving the fascial adhesions around the stomach area can really help. Even if you then just do the METs and don't even do the stuff in between, if that helps.
Yeah, no, interesting. Yeah, really interesting.
I think it's if she's very, I mean, Lisa's point, if she's very inflamed and aggravated, then sure, you're not going to go digging into anywhere that's going to be very sore and inflamed. But I think Claire's absolutely, you know, you do what you can, and if you can't get too far, then you've got other skills, haven't you? MET is a lovely one to work in the background and you know, lengthen. It's about lengthening and allowing the, you know, emotional aspect of that, having a sense of relief. Yeah, cool. I don't think from my point of view, I don't think I had any other observations really from a sports point of view. I don't know if anybody else is sitting there thinking about it. Can you hear me yet, Wendy? Because I know you were interested in getting involved this evening. I don't know if your mic's on and you can hear us.
Yeah, I can hear you all.
How are you doing? Nice to see you.
Yeah, it's just I've been at work from 7:30 until 6:45 tonight, so I'm just like a bit hanging today.
Oh my goodness.
That's no excuse not to be here.
I've just
That's a bit harsh, Chris. In fairness, that's a long day.
No. Don't listen to her, Lisa. She, you know.
I make it all up. I do look hanging tonight. I was thinking, should I brush my hair before I join them? Yeah. Do I eat something? So I've been eating and trying, but I haven't brushed my hair. So
okay.
Yeah.
You got your camera on. I can't see you yet, so I don't know if you got your camera on.
That's good. Yeah. I should.
Yes, it's on.
It's on.
It's on. Yeah.
Yeah, it's on. Yeah, so if you can see me, I do forgive what I look like tonight, but
I don't think anyone's worried about that at the moment, Wendy. I haven't had my hair cut for 2 months and it just grows out, right? And eventually I look like Ronald McDonald. I've just given up completely with the hair because it's just doing its own thing, so I won't worry.
Yeah.
Thanks.
I did a little bit of write-up on both reflexology and the massage. So I don't know, have we spoken about reflexology or not on it, or have we just been focusing on massage so far?
No, we've talked about reflexology, but if you've got anything to add, Wendy, you're very welcome to add anything in.
Yeah, so I'd have probably been, if I was doing the reflexology, be working on the sort of colon, pituitary, adrenals to try and sort of balance them out. So you would be doing the stress and probably linking the pituitary with the adrenal to just calm her down at the end, because I think it was mentioned she had like anxiety as well as the IBS going on. So that's probably what I'd be focusing on rather than doing the whole routine and making sure you'd done all of them. But I don't know what came up earlier, so hopefully along the same sort of lines.
We've talked lots of things. We talked about the diet. We've had a big discussion about the diet, what she could do, you know, in terms of lifestyle changes, maybe hobbies, mindfulness. So sort of working with a massage person maybe to help, stretches. So.
Oh, brilliant. Oh, that's good. So we'll carry on from where we are now. I'll chip in because I normally do sometimes, so I feel really bad. I wasn't going to try and talk quite so much tonight.
That's okay. Yeah, the other thing I did find on, I think it was on the list on the NHS, was vitamin D. Apparently, vitamin D.
Oh yeah, that's really. They
could be short of vitamin D.
Telling that like it's going out of fashion. Yeah, really. And with I would probably go for the vitamin D with the calcium.
Oh no!
I mean, she's the young girl we were talking about, so she probably doesn't need it. But if she came in and she was promoting those symptoms at sort of like 50s, 60s, then I'd probably say go for the vitamin D with calcium.
No, can I come in on that one? Sorry.
Yeah, of course.
Can I just say, well, a couple of years ago, I had breast cancer, and I was told by certain people, a number of people, in fact, that if you can, not to take calcium because it puts pressure on the heart. You can get most of the calcium you need from foods. It's so important to watch the calcium deal. I wouldn't recommend that to anybody. And whilst I was in London, just before all this coronavirus kicked off, I went to Body Worlds.
Oh, I love that place.
I know, isn't it fantastic? But they had all over the place about coenzyme Q10 is what you need to keep your body in tip-top condition. And yeah, vitamin D. I mean, we don't get enough sunlight in this country for people to get their recommended daily allowance. So I think it's a good idea to take vitamin D. But honestly, I would really be careful with the calcium. It really worries me, that calcium thing now, because I was taking calcium in mega doses, and I was told to stop because it's not very good for your heart. And if you Google it, you'll find that. So that's just one thing I wanted to say about that. Sorry, I didn't mean to jump in, but yeah, it worries me that actually. But the Body Wells, the coenzyme Q10, the ubiquinone, as it's normally called, is the one that you should be looking at. And if you take it not in powdered tablet, it has to be in a gel form, jelly capsule form. But yeah, that's one thing I did pick up. They had signs all over in Body Worlds about that, looking after, your body. Such.
Are we accountable as therapists to be able to be suggesting to take supplementary things? Because I would feel a bit worried about doing it. I think that's my nursing head, though. I feel like, oh, that's a doctor's job.
Yeah, no, I personally don't. Yeah, I stay away from it. Yeah, but yeah, I know some people, some practices they do, but I personally I don't. I think it's dangerous territory, and I don't go there.
I guess vitamin D, because it's like getting out in the sun. That's good for the soul as well. It's not necessarily vitamin D, but just supplements. I would feel really anxious about.
I think we've got to be really careful when it comes to kind of giving advice, and
I think I would often suggest to people that they need to do that research for themselves.
Yes.
that, you know, there may be something that is more beneficial, but to go onto Google and look at a reputable site or NHS or something like that, or go and see a qualified nutritionist or something like that, I think is the way to do it. So you've recognised that there is something they could do, but, you know, you put the onus on them then, don't you, to do it.
True.
Yeah.
Right.
Is there anything else we want to sort of bring in and talk about?
Don't think so.
No, I think my dog's calling me.
Still-
Oh, right.
Yeah. I found that I went offline for a period of time. I had a technical issue in my end, so I was teasing Wendy about her contribution. But I think it's a really interesting case study, Annette, and thank you for your you know, the work you put into bringing that in. And it's very thought provoking, these things, isn't it? Gets us thinking about our skills and how we share them.
Yeah. And good to cross all the therapies as well, isn't it? It's good to have a chat through all the
It's
therapies.
always a challenge,
Yeah,
isn't it?
I think it's brilliant getting everybody's opinion and that's what I really like. I joined a Zoom FHT meeting this week, and that was really good. I met up with 10 people, therapists from around Bath.
Yeah.
On Wednesday morning, so I didn't finish the meeting because I was in my lunchtime. But that was really good, talking to them.
Okay. Yeah.
So that's good.
So how many treatments will we see Elizabeth for?
Oh, reflexology, at least four. At least four.
At least four. Right.
At least, yeah.
I would say that hopefully, even after those four, she would come back monthly or something to just keep everything on an even keel.
So maintenance wise.
Yeah.
And I suppose that, I mean, certainly in the fascial, sports thinking, it would be very much along that if my treatments aren't helping, if there isn't stuff that's actually shifting and moving the condition along, then let's look at where there are other forms of getting help. It's fine to refer, isn't it? It's fine to get other people involved, and be that dietitians in this case, or be that back to GP for more clear diagnosis, or whatever.
Yeah, no, I think that's great, I do.
Cool. Thanks, Annette, for that. That's very nice of you to spend some time putting that together this week.
Okay, it's good to talk.
Yeah, it's good to share, isn't it?
Good.
And I suppose we've got sort of half an hour or so till 9 o'clock. So is that general kind of sense of opening things up a bit, and where are people? How are we getting on? Where are we in terms of our thinking about our clients, and that usual kind of debate that we have about how we keep things going in contact with people. And I always think it's helpful just to think and share together about how this moment feels for us, and what are we doing now, and the kind of things that or questions you might have for us. I know Hannah's in the background there somewhere, so that kind of things that we can think about or talk about or whatever.
Oh, hello. Oh, hello.
Natalie last week had said about doing the risk assessments.
Yeah.
When we return, the FHT were on about those as well, that they were going to hopefully bring some out. So I don't know if Natalie actually is going to be looking at them and sharing them with us. I don't know what other people
tonight, is she? She's not in the back. I think she's around tonight. So I've got half a memory that she said that last week, that she was going to be tied up this week.
And I don't know if all the rest of you have started looking at doing risk. You probably have, Chris, but I don't know about the other therapists, whether they've started doing their risk assessment.
Do you mean in terms of getting back to practice and putting measures in place, get PPE and things like that?
Yeah, I think when we go, we have done risk assessment of your reasons, and the washing and what antiseptics you're using on the couches and on yourself, and how you're preventing cross contamination between each client coming. So a bit like a hairdresser, you wouldn't have to be in that chair did your colour. Or, you know, were you washing the door handles or wiping the door handles down between clients? So perhaps you wouldn't have quite as many clients in a day, so you would have time in between treatments. But that was just what was coming out of the meeting that I had on Thursday morning with the other therapists.
Yeah. Right, yeah. Is that with FHT?
That was with FHT, yeah.
Yeah, because that's who I'm with, and they sent an email out, obviously at the moment, saying still can't have any face-to-face contact with clients. But yeah, that's interesting then, if there's sort of the general consensus is looking forward to going back gradually, like you say, less clients or plenty of time in between, and just loads of hygiene stuff and PPE. Because my physiotherapist has opened up again, almost on a trial basis, because whoever their governing body is said it was okay, so long as they put a lot of measures in place to help protect people. So I went along as a bit of an experiment, because I said if I wanted to go along for the week. And in fairness, it was, I mean, it must be driving them nuts, because my physio had, I mean, I was met at the door first of all, they lock the door, you're in a waiting room on your own, obviously waiting to go in, and the person that comes out before you is sort of, not miles away, but is a good sort of 4 meters away from you. And they just have, contactless payment. They've increased the amount that you can do. They've thought of everything, really. So usually you have to input your registration number for the car, so you don't get a payment charge. They do that for you. You get a mask on. You have to clean your hands. My physiotherapist looked like Darth Vader, to be honest. I didn't reckon. I was like, Dan, is that you? And he went, yeah, don't ask. And he was obviously, he had a visor, a face mask, and a disposable, I want to say like an apron, like they do in hospitals. We have like a disposable thing. So yeah, but he said it was really hot to work with.
Yeah, he boiled.
Yeah, he said it was because he'd been in that get up all day. I mean, they only were running in this clinic for a week just to see, sort of Monday to Friday. But yeah, you could see it was stressed them out a bit, having to do all this stuff, and obviously clean out the couch in between, and like a fair play. I mean, for me personally, it was safer to go there than it would to go to the local supermarché where people are completely ignorant and, do you know what I mean, ignoring the one-way systems. And,
I was going to ask that, Lisa. Would you have felt safe if you were a client going for a treatment?
I went there because I am a client of this guy. He does really good sports massage, and also has helped me strengthen my back and stuff in relation to a really old shoulder injury. It's really helping. So I'd sort of seen him anyway, on and off. So I just thought, well, I live on my own. I've got family that are in self-isolation, so we've just not seen each other other than video calls anyway, Mark. So, and I'm working from home, so I think, well, you know what I mean? I'm pretty confident that I'm okay and not pass anything to anybody at the moment. But yeah, I felt fairly confident, and more confident than I would going out to the shops, because no way, as we all know, some people are completely oblivious to this, clearly. God knows what planet they're living on, but it's quite worrying. Yeah, but I felt sorry for him, and he said it was hard working in the PPE all day. I mean, I think he'd only had sort of half a dozen clients that day, but he said it's hard work, really hard work. I'm just remembering to do everything. It's just like a whole new routine, I guess, and even for the receptionist. But they couldn't have done more than they've done, to mitigate it. It's one of those things, isn't it? I think you can do everything you can, and still something could happen. But Yeah, it just seemed to put them under a lot of stress, I would say. But I suppose the stress of worrying about, is this all okay? And I don't know.
Well, the FX here are recommending that manage to print off their little posters that they send with the email for you to put up on the door. So I don't know what they're about, but they're recommending that you take people's temperature when they come in.
Oh yes, they did that as well. Sorry, yes.
You know, everything wiped down, plastic container with a lid on to put dirty clothing in, and you change your uniform each time, which is fair enough. The only thing I'm not looking forward to is wearing a plastic apron. I've got an apron and I'll change it every time along with my uniform, but wearing plastic aprons, I'm not really quite sure.
I don't know what that would actually do. I presume it would just save the person changing their outfit in between clients. I guess that's the idea. It's just another barrier, isn't it? I guess, but
they're
all of that get up.
Change your uniform in between every client.
Yeah, but I guess for him that wouldn't be practical for like 6 people, 6-8 people a day or whatever. I don't know, but
it's just common sense, a lot of thing anyway. But you know, that was one thing that I did notice, that they recommend you take people's ear by the ear. You know, so I don't know. I'll have to buy one of those, I suppose. But
or lots of outfits.
We shall see.
We've had access through, you know, a number of professional bodies that are all saying the same thing, all presenting the same issues, all giving us the same kind of advice around the things that we've already sort of talked about and mentioned, really. And I think it's early to predict how it's going to roll out, really. But there will be I don't know if you did, Lisa, but there will be that sense of a declaration, you know, that you state, that you sign on your consultation form, that you have taken the precautions that you need to, you know. So there has to be a sense of people taking responsibility for their own actions.
But it is difficult though. Before they locked us down completely, I literally, you know, in that sort of like a few days before it was complete lockdown and it was what we're doing, what we're not doing, I had a couple of clients booked in before they then decided, no, you can't practice anymore. And at that point I was saying, obviously being more, well, not any more or less hygiene, you know, doing what you'd normally do. But I was saying to the clients on the way in, can you just clean your hands with the sanitizer? But one of those is a friend I know very well. She went, well, I'll wash my hands before I left home. I mean, I think things would be different now, but there was initially a bit of resistance, even trying to put things in place. Yeah. That concerns me a bit, that people are maybe going to be a bit resistant to it. But then if they've not had a treatment for so long, they might be in the stage where they're like, I don't care, right? You can put me in a chemical warfare suit. just treat me, you know? But you know what I mean? I wondered, people like, especially when a lot of my clients I know through work and are really good mates, I'm a bit concerned that that'd be right. Oh, come on, you know. And so, but I think it's probably people are taking it more seriously now anyway, and I think people are actually like, yeah, actually this is what I need to do, fine, what treat me, whatever I need to do. I think but initially I was a bit like, oh, yeah. So,
I think the bit that I pick up is that actually people are very frightened. People are very frightened. And we you know, the good old BBC have done a fantastic job of scaring the
hell out of people. I think they need a really scary voiceover man to do it as well, like today the death toll is maybe like a bell or something. Maybe not, I don't know.
Maybe they've done a really good job of scaring us out of our minds. Absolutely.
They don't focus on the amount of people that do recover from it very successfully.
No.
But it is frightening though, because I'll shut up in a bit. I'm talking too much to you because I live on my own, you see. I started talking to my dog. I don't even own a dog.
Doing a Shirley Valentine.
Hello, Rock. That was such a good show. We're going to go off on a massive tangent if we do that. I totally lost the thread of what I was going to say now. I'll just shut up in a minute. I don't know.
Shut up, Liz.
Sorry. I'll just shut up. Just tell me to shut up. Because I've
I can
actually lost the thread of what I was going to say. I
Yeah.
mean, what I was going to say, there was a really good documentary, but you have to be in a very good mood to watch it. It's a two-parter on the BBC iPlayer, where very early on, the first week of lockdown, they sent a camera team into the London Free
Yes.
and followed the
Yeah.
and it's actually obviously a very accurate and fair reflection of the battle. Do you know what I mean? You see firsthand, literally, what they were up against. And one of the very interesting things you never would have thought about, and they never would have thought about, is that their oxygen supply in the hospital was almost compromised because of the demand, and they had to build 2 extra tanks for oxygen because everybody was literally surviving on this and needing a ridiculous amount of oxygen. And they got to the point where all the alarms were going off because the system was under pressure and quite an old system. So I had to actually build extra oxygen tanks just to function.
Yeah.
You know,
been
massive.
There are many stories like that, aren't there, that are really alarming and upsetting to hear. You know, I personally find myself more and more reminded recently about the elderly and how appalling they've been dealt with. Really, we've lost many elderly people, and I feel very sad about that.
Yeah, so it's something that accounts for something like 40% of the figures or something crazy. A lot, you know, far too big a proportion. Anyway,
I can give you a bit. Are you interested in a percentage figure? Are you into? Are you?
No, yeah. Oh, yeah. Go on.
You might, as you live on your own, Lisa, you're like this.
Yeah.
So this is a global.
I'm easily entertained at the moment, Chris.
Sorry.
I'm easily entertained. Sometimes I just sit and watch the washing machine go round.
Lisa, we need to talk more. This is good. We can have a conversation. So this is a global figure, all right, not UK. This is the whole world. The amount of people that have actually died from this, in terms of a percentage, is 0.004.
Is it really?
That was given out about 3 or 4 days ago. So globally, the amount of people that have actually sadly lost their lives is 0.004.
Wow.
Yeah. That does put it into a much better perspective, actually, doesn't it?
Yeah.
Yeah,
There's nothing to worry about. I'm just going to go out now and do my shopping without mask on and bump into people, and I'm not going to wash my hands again ever now. I feel much better about that, Chris.
Well, yeah, we can. I'm not saying anything. I'm not saying this.
I know. You know me, Chris.
Of course, it's very serious, and of course, it's very alarming. And people have lost loved ones. It's just devastating. I don't.
Yeah.
But there is interesting perspectives on this. We never hear about people that have actually got better.
Oh yeah, and then there've been people in this document. Oh, we'll shut up a minute. In this documentary, there was a guy who'd had I think it was a kidney transplant. So obviously his immunity was sort of somewhat compromised. He caught coronavirus. It was so bad he went on a ventilator for days, but he's then make a full recovery. And they said all along, they went, the joke of this is his kidneys do really well. But he made a full recovery and went home. And even the consultants were saying, this is not looking good. But yeah, the amount of people that were, you know, that have fought it and survived, but it's just not publicised by the press.
Yeah, we don't hear those figures at all.
No, I don't know why. Because you'd think, well, people need that positivity. They need to know that people have actually been seriously ill and recovered, fully recovered. So,
yeah, absolutely.
Yeah.
I don't want to. Yeah, I just think sometimes perspective is worth listening to.
Yeah.
Other things that people want to bring in or think about, because we don't, you know, if people are in a place where we can just move on, then we can just move on. And
I don't know. Just really, does anybody actually know yet? I mean, I'm planning to open on the 1st of June because I have to, really. But then most of them, because of where I live, my clients are visitors and I don't have any. So I'm not really quite sure what's going to happen about that one. I think I might just end up writing this year off and, you know, yeah.
It's very difficult to plan, isn't it?
There's 2 bits that need to come into place before we open. 2 bits. One is that we provide an environment that is safe and we do need to, regardless of how we feel about it, we need to provide an environment which is recognised to be safe and appropriate in the eyes of our governing bodies, be that whoever we train with. And secondly, the important thing is obviously whatever we do and however we set up our practices, our businesses, that is acceptable, and we have the right clauses in place in terms of our insurance.
Yeah.
And they're the two things, aren't they? That we are looking after ourselves safely and our clients, and we're also in a place where our insurance companies are saying, yeah, we agree with that. You put all the things in place, get on and get your business back up and running, and let's crack on. I'm not sure about the 1st of June. Personally, I don't know what other people think.
I thought it was July.
A lot of the people that I was talking to on Thursday, whatever day we are on today, no, Wednesday, they were all talking that they weren't going back till September.
Oh, really?
So that was the overall consensus, that most of them didn't think they would be set up till September.
Was that just a personal sort of call on that? They thought September, or have they been given any advice?
I think that was, I don't know, from reading the FHT stuff from, the AOR, and it wasn't looking hopeful, but I'm governed by when the salon goes back, so I wouldn't be able to go back until my salon opens as well, which is connected to a hairdresser's. So
yeah, my hairdresser's written to me and said that they're opening on the 4th of July.
Yes, I've heard the same.
On the 4th of July.
Yeah, that was the date, wasn't it?
I mean, I received an email today from. Chris will know this. I went to see them about my black toenails. They went and sorted those out. So I've got an email from them, Superfoot in Cheltenham, and they said that after considering the new guidance out by the College of Podiatry, we're delighted to be able to resume our services to patients. So they're opening up. I mean, when I went to have the work done on my feet, I mean, because of the nature of their work, they were already dressed in PPE. Right. Had like the gloves and the big sort of face visor and stuff. But they've obviously got to take precautions with their hand sanitizer, which they are. But I was a bit surprised to receive that email, if I'm being honest, that they were opening up so soon. I didn't think that they would actually be allowed.
There isn't that, as far as I can see, and the stuff that I'm reading, there is no clear statement about anything.
No,
there isn't.
Can I just clarify about the foot care professionals? And it really is for emergency appointments only. And you've got to kind of, as a foot care professional, you've got to make a decision whether not treating somebody due to their health and well-being is greater than the risk of them getting COVID, for example. So if you have an elderly patient and they can't walk because their fetus or they're walking funny and then they fall over and then go to hospital. So really that's what foot care professionals need to be doing and thinking about. It really is sort of emergency cases only.
I mean, that's interesting, Michelle, because I'm looking at the email now. It does say to provide clear guidelines to allow us to reopen clinics to some of our patients, but on the email it doesn't say anywhere that it's for emergencies only.
Interesting, isn't it?
It is, and I'm guessing, for instance, FHT would obviously wait to see what the government are going to say, because everyone's led by them, and then, like you were saying, Chris, earlier, there would almost be a sort of common minimum standard of PPE or whatever they decide to put in place, and you're covered by insurance as long as you adhere to that. As long as the client's happy that that's what's going to happen, that would be sensible. But
people that are suggesting September are probably reading the Daily Mail.
Yeah.
Probably reading. They might be looking on BBC website. That's always a good one. Or maybe the Express. The Express is a great paper for scaring the pants out of you. And it will be 2022 before we start again. That's my personal.
We'll all be suffering with mental illness by then.
Yeah. Chris,
you
I'll
know.
have to get your WhatsApp off you, because there's a brilliant thing that came out on Facebook today where it's basically taking the mickey out of, you know, so-called Facebook experts.
Oh yeah.
It's very, very funny, actually.
Yeah.
Sorry.
It's a whole environment of Chinese whispers. I was speaking to somebody the other day, and they mentioned, I'm sure it was September. I can't remember now. Really? And off you go. Everybody knows that it's September. Sorry, Wendy. Was it a bit?
No, not at all. I wasn't thinking of going back. I was hoping to go back before September. Yeah. So as soon as the salon opens up, I hope to be able to start back up.
Yeah.
That would make sense, though, wouldn't it? Because
we'd
probably be lumped in that bracket.
Yeah, I think.
Yeah.
My sense of July, August will be about right. I think.
Yeah.
You know, I think you're right. Well, at the point where pubs and clubs and other things can start to open, at the point where, you know, schools and kids are going back to school, then, you know, hairdressers and what we do and beauty therapists, we'll sit in there somewhere, you know. So somewhere between June, July, August, we'll be up and running, I guess.
The village today was very, very busy. The village where I live today was very, very busy. You wouldn't know that coronavirus was about. And like lots of the old people were out because it was like, oh my God, we're allowed out. So what can we do? Get shouted at. Oh, let's go down to the chemist. So a lot of people I haven't seen since before lockdown came in today. Get their medication, because I think a bit like Lisa was saying, you'd all go mental if they were locked up for much longer.
Yeah, and it feels like we're very much led by what's going on and what other countries are doing first, aren't we? So, you know, we're looking at the Germanys, we're looking at the, you know, the France, we're looking at and the Denmarks, aren't we, to see what they're doing and modelling maybe what they do to some point, or not if it doesn't work, because they're a little bit ahead of us. So yeah.
And I've got a conspiracy theory under my hat, so I've got to be careful.
Go on, Chris.
Me too, Chris.
What is it?
In actual fact, I'll just say, my ex-husband lives in Japan, and there is no lockdown. There's nothing there. They're just going around as normal. No mention of any virus and whatnot.
In Japan, they have a state of emergency, but the constitution doesn't allow them to have any lockdown. They can only suggest for businesses to close down, but the general population, they are quite diligent. They do follow it, but yeah, I mean, people can still go out and about and play golf.
That's what they do.
If they want. They can't enforce a lockdown like they can here.
Yeah, but they're not required. They do it anyway if they need to, don't they?
Yeah.
I think Japanese people are very good at organising themselves. They don't need to be told and all this rubbish.
Hang on a minute. I'm very good at organising myself. It's not just... Are you good at doing what you're told, though, Chris?
Yeah.
Sorry?
Are you good at doing what you're told?
You probably know the answer to that, Mark, don't you?
Where's Judith? We need Judith to ask.
When in doubt, say no.
Are you a Davy Dyke fan then, Chris?
Do you think? No.
Oh my God, lizard people.
Dolores.
That is so far out there. It's unbelievable.
I think I find
she's a microbiologist. She knows what she's talking about. Dolores Cahill. She's brilliant. Yeah.
I think fundamentally, I worry when I hear how frightened people are.
Yeah.
And that there's right to be concerned, but the amount of fear involved I find alarming, and it's going to upset and disturb a lot of people for a long time, and people's mental health, good people's mental health, who have children and work and what have you. I find it deeply concerning that not enough thought has gone into how we process this information. I was told on Monday that this is the worst effect on the country's economic situation ever, and that was the most important news to tell me at the first thing when I turned on the radio. Nothing else mattered. How many people are alive today? Not important. what's important is that our country is going to go into the deepest recession ever. Ever. And for some reason, that was felt to be the important thing to tell me, and I felt furious about it because, you know. Anyway.
But the thing is, Chris, I think they literally don't have any other news. They just don't have any other news, Chris. That's all they've got to focus on.
Yes,
and it's
Brexit,
not healthy because there are
yeah.
you know, they don't. I mean, local news are better at publicising good news stories, aren't they? They're, you know, sometimes you don't want to see them because it's somebody seeing some out-tune rendition of Will Mate again in a middle of a street, and you know everyone else is cringing but sort of clapping at the same time, going, "Please shut up, for God's sake! I just want to go back in my house." But yeah, they don't. There's a lot they could do to make the news more positive, and they just don't. And I do think they've got a massive responsibility to me. I'm not a big fan of the press anyway, but they've got a massive responsibility, and they should be held to account more, I think.
Yes, definitely.
Because one person quite vulnerable, sat on their own with existing mental health problems, could be massively impacted by what is put across and how it's put across. But anyway, I'll start on a rant about the press. So I've got plenty of stories about them, and let's not go there.
Okay. We don't need to sit here and rant unless we really want to.
No, let's not do
we can move on and say cheerio to our Thursday evening. Nat, I want to thank you again for your hard work. That's really helpful, and it focuses our minds, doesn't it, and reminds ourselves what we're good at.
Yeah, and it's good to hear everybody else's perspective as well, isn't it?
Thank you very much, Annette. That was really good. Yeah, as I say, it was really interesting to hear the perspective from reflexology and stuff, just the different treatments.
Yeah, definitely.
And I learned from sports.
Okay, I'll shut up. I think that's probably the best thing. be quiet and keep my bloody Maori mouth shut. But no, I'm not actually. I think I like what I like about reflexology is that kind of circle of it. You know, that with sports massage tends to be, or massage, we go into a certain area and we trigger in a certain area. But what I've learned tonight, I suppose, is that reflexology gives that kind of holistic with the W. You know, that it is whole. It is starting from one journey and going right the way round the body, with the idea of if we work on all the different areas, you're creating an environment which will heal the whole.
Yes.
Is that right? Is that a good summary?
Spot on.
Yeah. Rather than thinking, oh, well, I must work on this person's digestive system, or I must work on their stress levels and their hormones, you know, adrenaline or what. I don't know. My AMP is pretty rubbish, but
is that the reason why you can book blocks of reflexology massage, because you're treating it as a whole? So you can say book a session of 4 reflexology treatments. For instance, I personally wouldn't do that for sports massage. You know, I'd say go give a treatment, you go away, see how you feel, when you want to come back. You know, you probably want to come back next week, but see how you get on. And sometimes they might come back, sometimes they won't. So in some ways, that's the big difference I noticed, that you would do blocks, and I guess that's because you are treating in a much more holistic manner.
No, you wouldn't see the effect of the treatment. If someone comes to you with something like IBS, it's no good having ad hoc treatments here and there. You have to give them a course of treatment, and then you book them in then for maintenance, or for once a month, or clients every 3 months. So it depends, on where they are and how, and where, what you've achieved so far. So yeah.
Cool.
That's good.
Thank you.
Oh, I'm getting darker. I think my room's getting darker.
I put my head torch on, so I'm pretty good here. I'm all right. Wendy, you look like you're lit from behind.
Oh, I'm in the kit. I am lit from behind. I'm normally sat the other way round, so I'm window behind me.
Wendy, have you had your dinner? Have you had your dinner yet?
No, I didn't. Plate beside me. I'm just looking at it, going like,
oh my goodness.
What's you tonight then, Wendy? What are we having?
What are we having today? Well, we've got ham and cheese.
Really? That's a regular thing, isn't it?
No.
My diet is just we had a lady fall in the street today. Forgot about coronavirus because some guy came running saying this woman's collapsed outside. Blood everywhere. I don't even do blood, so how I coped, I don't know. and sat on the pavement with her for 2 hours, and like I'm stood behind her holding her head like this, thinking,
Oh no. Oh.
She's had it stitched. She's all right now. I've just dropped some flowers in on the way home.
Yeah, nice.
And I'm very, very sorry. I didn't mean to be rude and join you all late.
Oh no, that's not a problem at all.
I will listen back to the video later. And I did like your bony, spiny video, Chris. That was good. The one after the email. So thank you for that. I'm loving all these little videos. I'm doing all my CBD points on the FHT.
Oh yeah.
That's really
good idea.
Like a little sheet at the end. I thought it's like a school again.
I put out a video today on massaging the lower back and lower back and glutes. It came up last week, didn't it, in this group? And so that's on the website. Yeah, it's on the blog page and the website, and it's also attached to these notes, I think, on Teams. So it's in the file system of this log. But if you want to see it, I think it's been put up.
It's like instead of bedtime in now, I'm listening to FCAOR video. About 10 minutes, aren't they?
Say again, Wendy. Sorry, I missed that.
Instead of when I get into bed, instead of like reading a few pages of my book before I go to bed, I'm like, I so don't want to get behind by the time I start again. I'm listening to like a reflexology video, massage video, aromatherapy video, whatever. And then I'd like nod off. And then I go, oh, I better watch that again tomorrow. But it's great because they're only about 10 minutes long. And you don't have to do a spreadsheet for all of those. So no, it's good.
Have a look at what I've done today. It's about lower back pain and working on QL and glute maximus and SI joint maximum massage. So it was really came out of the back of last week when we were talking about the whole kind of what happens when you got that lower back sacrum.
Would it be good?
Yeah.
Bless Judith. I don't know. My marriage is on the holding on to a hair string. I use highlighter pens to draw on the bottom, and so that's it.
Well, as long as the pen comes off, Chris.
She enjoyed it.
It's like laying in bed. It's like sleeping next to a cartoon. It's got these lines all over.
There's a pen come on. You're not using permanent marker, Chris, are you?
I can't tell you.
Just sort of hanging on by a thread.
I can't tell you that. I get told off if I tell you that. Yeah. It involves...
I've used the wrong pen, love. Sorry. What?
Well, you got to look at them, Lisa. There's not one pen. There's about half a dozen pens. It's a fairly...
Yeah, that's true. Yeah.
So, I just really like that idea of drawing where we don't do it. We don't have time in the classroom when we do this stuff to draw where the muscles are, and it's quite good to do that. And the basic bony landmarks are quite helpful to see and to play with, and you just don't get. I mean, I'd like to build it into the classroom, but I don't think you really get time. I don't really get time to do it. So anyway, right.
That's good.
All right. So when in doubt, I don't know who you're going to draw on, Lisa. You'll find somebody.
My invisible dog, perhaps.
Yeah, I was going to say.
Perhaps I could abduct the postman on the way through.
Wow, there's lucky postman. Is it a postman or a post lady?
It depends on the day, to be honest, Chris.
Yeah.
Depends on the day. Just a quick one, Chris. And I'm sure you don't know the answer to this, but you know, what are the winning lottery numbers for? No, not really. If you did know, that'd be great. We go halves.
7. Right, I've got them written down here, Lisa.
Oh dear.
Whatever you do, don't share it with anybody, will you? Keep it quiet.
I won't. We'll switch all the cameras off and the audio.
Yeah.
No, sorry. I've obviously just got the AMP exam left to do.
Yeah.
But I appreciate usually that's going into the academy and being, vigilated there. So I'm guessing none of that will happen until the academy reopens, I guess. I just wondered if there'd been any update or any.
Yeah, there is. So the first question is, have you booked your practical? You've done your practical exam, haven't you?
Yes, I decided to take the results of the mock, and thankfully I made an effort in the mock, so I passed.
Bloody hell, that was a fluke then, wasn't it? Well done.
There's no need for that, Chris.
Okay, I love your humour, Lisa. We could. I miss seeing you on a Thursday where we can, in depth, fall apart into stupidness. I miss it. So the situation is that we've just heard this week. We've been working with iTech about so people who have had their practical or got their practical exam booked. So you might have it booked in September, or you might have already done it, or whatever the scenario. You can, iTech are allowing us to have, they've designed a portal where you can sit at home and do your AMP at home.
Right, okay, that's cool. That's cool.
All right. I know Olivia is in the process of untangling it in terms of the actual details of that hasn't come through. So basically, I think it will work on the lines of, we will send you a link, you will book in with a password that then takes you into your AMP, portal. You will need to record yourself in some format, so be that with Zoom or however you do that. I don't think that's quite clear, but you will have to find some format of recording yourself taking your AMP exam.
Okay.
And that, then from the back of that, you get your result.
Yeah, no, I just wonder, because I'm not very good when I don't have something to work towards in terms of a time frame to study. Because then, I'm not very good at kind of keeping that momentum up if I don't know when so it's difficult, isn't it? So yeah, it doesn't matter when it is. It's just if we had a rough idea, I could then.
In theory, this could happen over the next couple of weeks or so.
Cool. Okay. Yeah.
So probably in terms of, if you feel that now's the time and you feel up for that, then drop Olivia an email and just say, look, I know that's kind of around the corner. Could you bear me in mind? Cool. Yeah, I think there's probably, I don't know, 30 or 50 people all in your position.
Yeah, I'm sure.
They've got their grades, but they want to get this AMP out of the way.
Yeah.
And you can do that now through the iTech portal in your home online.
Awesome.
There's bits and pieces that we've got to kind of get sorted in terms of how you record yourself and blah, blah, blah.
Yeah.
In theory,
I appreciate that. I mean, there's no huge rush, is there? But that's good to know that they thought about that. Bless them. They've been pretty good, actually, haven't they? iTech.
They have. They've wanted to make sure this kind of comes together, and there are a lot of people who have, we're just a small place, and but many people have taken their exams but haven't been able to take the AMP aspect. So.
That's good. No, thanks, Chris. That's good.
That's been thought about, and that's just come out. I don't know, beginning of this week, end of last week, really.
Yeah. Good. I'll make my Saturday group aware of that, because then they make sure they know about that. Yeah.
The criteria of it, I think we were talking about it a bit earlier today. The criteria is that people need to have booked their practical
exam.
Having said that, I mean, the point for me will be that, well, I can book my practical in September, and let's just say you're halfway through your course at the moment, you're thinking, okay, I want to book my practical course in September. We can't say at the moment, normally there's a whole kind of gathering of numbers to make sure that we know that we're not overloaded in September with 50 people. So I think iTech are going to need to be a bit more flexible in terms of moving dates on. If we can't do, or we might get the examiner for 2 days, or who knows? Who knows? There's lots of ifs and buts around all that. But in theory, you can book your theory in September and then get on and do your AMP now. Some people, I've got 2 or 3 people on my level 3 course that are wanting to do just this. I want to crack on, get the AMP out of the way. It's a good thing to get out of the way. It's also a great time to get all the assignments out of the way, isn't it? And any essays and all that kind of stuff.
So is that the only date that we've got practical exams booked up to is September? There's no dates beyond September, is there, for this year?
I don't know.
Well,
I guess
yeah,
not.
I
But
guess they would have been made quite a while ago, wouldn't they? Because obviously we can't make new ones, can we? Yeah. So.
And I don't. Yeah. There's too many ifs in all that, aren't there?
Yeah.
So I don't know. I don't. I think there's going to need to be an area of flexibility in the system. Our end, and also obviously with ITEC, they're going to need to be flexible to make all this work. There'll be a big backlog of, we've got 100 people that are, the deep tissue courses, the trigger point courses, all the things that all the workshops and bits and pieces and small day workshop pregnancy courses, all that we're going to fill in and start to fill the gaps in.
Yeah.
Anyway, let's see.
Well,
and your pregnancy massage stooges will have given birth by then as well. Probably.
I think
that might be an issue. I'm just thinking that might be an issue. So.
Yeah. For me or for you or life?
Well, I don't know, but it might be just a consideration. I don't know. Just ignore me. I'm going to go in a minute. I've chatted far too much tonight. You need to just, you know me well enough, Chris. You just need to switch my mic off remotely when you've had enough.
I can do that.
Just kick me out.
You look like. Have you got a power cut there, Lisa, or what's going on?
No, the thing is, as soon as I leave for the light, it'll be time to finish. All right, hang on.
I'm thinking I look like the angel Gabriel. This white.
I'm better in the dark at the moment, anyway.
You look a bit angel-like. No question about that. Yet. You look angel-like. Do you hover? What's that word when you fly off the ground?
Yeah.
Levitate, isn't it? Is it levitate? Hello, it's here. Hello.
Nice to see you. If you are really nicely, she'll show you her back with all these lines on that.
Yeah, I've been hearing about the permanent marker.
It's a form of abuse, Judith, I think, really.
Well, when I looked it up, I thought, oh my God. But it doesn't matter, does it? I mean,
no.
So you're modest, don't you?
Yeah. There's a few hundred people.
It's a good introduction to the less than glamorous body.
They just have to get their feet out in my house. It's not a problem.
Yes. That's it, isn't it?
Could you do reflexology with people's feet through a letterbox, perhaps, or is that a bit not very professional?
Oh my goodness, yeah, that would be interesting, wouldn't it? That would be interesting.
Yeah,
I saw on. Sorry.
I think you brought up a brilliant idea there, Lisa. You could do head massage, couldn't you?
Yeah.
I don't know if you fit a head through a letterbox. I'm probably struggling to fit feet through a letterbox. I don't know. Cat flap though. Cat flap.
That's the answer.
That would work. I saw a brilliant thing actually they've done in the States where, and this is a nice story to end on a nice story, where the kids were getting really upset they couldn't hug grandma. So what they did is they put a big plastic screen up. And they used, the disposable gloves that vets use, I won't say what for. They basically put arms, like disposable glove-like arms. So basically, grandma could go one side of the screen and put her arms through to hug the kids, and the kids could do the same. So they could hug it. Honestly, it's brilliant. It honestly brought a tear to my eyes. It's fabulous. Well, and the kids were literally fighting each other for a hug with grandma. It was great. Absolutely brilliant. Brilliant idea.
I don't know. I mean, I really miss that professional touch we have with our clients, and that kind of greeting and that warmth and that communication you have with people just by holding their arm or helping them on the couch or off the couch, or just that day-to-day contact. I'm really envious, even though, Wendy, bless you, you helped some poor lady fall over the day and you stood in front with her. I'm thinking, lucky cow. how lovely to be in a place where you can actually hold somebody's head up for 2 hours. Or what.
And the manager came out because I didn't have a mask on or anything, and I could feel her like somebody's putting a mask on me. So the lady from the pharmacy hadn't come out with no PPE on, was holding this bloody head with a little tissue bag. Oh my God, I don't look at that tissue, but I can feel that that one's wet now. So let's go on to the next one.
Yeah. Oh my goodness. But that's human nature. That's your human nature.
Yeah,
You can't stop that, can you?
to do that again.
It would be horrendous, wasn't it?
Yeah, it was horrendous. And we were the talk, and a district nurse came by with her 2 dogs going, well, you're doing that all wrong. You haven't got her in the recovery. I don't even know. She is looking a little bit pasty. Yeah, so let's between them. And she was going, tell that nurse to go away, Wendy. And I go, I think we're doing all right. She goes, well, you haven't got her in the right position, have you? And I'm like, no, I'm not a nurse, but if I look at that pool of blood, I'm with her. So just move along, and the ambulance will be here, I'm sure, within the next 2 hours. 2 hours rinse.
God,
that's entertaining. It added a bit of excitement to my life.
Yeah, well, rich texture, I would say.
Yeah.
Rich texture. Good stuff.
You know, and this keeps me going on a Thursday night. I think, oh, there's normality out there.
Oh, bless you.
Well, I'm not sure how you managed. Can I just, before we go, I want to ask about your good lady wife, and if she's all right, and what's happening for her, and can I ask, I mean, where is she?
Yeah, no, she's still in Japan at the moment. She's planning to come over at the end of the month, and I think when she arrives, she'll do 2 weeks quarantine, self-isolation here. But yeah, as I think Juliet said, I think Japan is still in. They've got a can't remember what it's called now. Well, they're not on lockdown, but they're state of emergency. But I think it's going to be lifted soon because their numbers have gone right down. But I think there is some dispute as to why their numbers are so low, and it could be to do with the level of testing. But yeah, she's doing fine. She's doing okay. She's just she's sorting stuff out with work at the moment because she obviously has to like travel a lot with work to all these different countries, which is not possible at the moment. Yeah. So I think things are on hold there indefinitely until things become a little bit clearer. So she can spend a bit of time in the UK. And
is there I mean, here obviously we've got that furloughing kind of scheme where you know people who can't do their work, or is that around, or is that part of a package out there, or is there government kind of support?
I think there is. I'm not sure if there is some government assistance. I think there is. I don't think it's to the level of the UK here, but her work's slightly different. Her work is based on all the projects that she does and how much time she spends abroad. So she still is actually getting paid, and she works a lot from home anyway. I'm not 100% sure of how it's all structured, but yeah, she's not actually affected just because of the way her salary is structured anyway.
Lucky lady.
Really good.
Yeah.
Just as a question, have they said anything about extending the self-employed scheme beyond June? Because I know they're doing it for the furlough.
Yeah.
No one's said anything about the self-employment scheme.
They have. I imagine that's going to happen, Annette.
Yeah.
I think it's just around the corner. It has to, doesn't it?
Yeah.
It has to.
Yeah.
It has to. But yeah, at the moment, just October's been talked about in terms. I think there's going to be a sliding scale, isn't there, from August to September? I guess there'll be, at the moment it's 80%, but I guess employers will be contributing to that amount. I guess at some point that sort of rolls out.
I was just wondering whether I haven't heard anything, but I don't know.
I haven't heard. No. I signed up when all this started. I signed up to the Gov UK, daily emails of news, and I get about 25 emails a day about any small thing that they decided to oil the wheels of the merry-go-round on the playground in the middle of that.
Yeah, you know about it. Yeah, if a woodlouse went across the floor, you'd be notified. Yeah.
I get notified that the dog bins full
Yeah.
for an hour full.
Yeah.
I'm not kidding. I mean, you get every bit of information about
Yeah.
anything that comes out of our wonderful government. And most of it is rubbish, but there is. I do it because
Yeah.
those kind of information is really helpful.
Yeah.
All right.
Okay.
Is it time to say goodnight?
Cool.
Yeah, reckon so.
Yeah. Really nice to see some face. Nice to see you, Michelle. It's lovely to have your contributions and your insights. So thank you. These things only work. Yeah, they only work, these kind of events, if people come and say hello and just listen in and chuck in a few silly words and smile. And
Well, it's been great to connect with you all. Thank you. It's been very enlightening.
I'll see you Saturday. Right, I'll see you Saturday.
Yeah. You're
And I've just been past this, which is rather nice, isn't it? So
That's all right. Hang on, I've got a cup of tea. I've got a cup of coffee here. Mark is now upside down. Oh, no, where are you off to, Mark?
Nothing. I'm just drawing the curtains.
Oh, right. I'm worried about you. I thought you were off to get yourself a glass of wine or something.
No, more like a cup of tea, I think.
Whenever I talk to Olivia on Teams, Hannah, are you around? She's around. Whenever we speak to Olivia, she's kind of on the move. So whenever you talk, it's like, well, I'm just going to walk the dog, or I'm going to hang my washing out, or I'm going to.
She's eating your dinner.
She's eating a meal, and you see her doing a meal while she's.
Oh yeah, she's always cooking. That's true.
Yeah.
She's multitasking.
Yeah, is that what? Yeah.
Yeah, I can't do that.
I can't do that. I'm a bloke, so I just have to sit and sort of concentrate with all my might on what's going on in front of me.
Yeah, same for me, but I can draw the curtains at the same time.
Yeah, you're doing a good job.
Thanks.
Okay, guys.
Right, I'm going to say goodnight. Good night,
Yeah,
everybody.
Yeah, good
Right,
night.
thank you.
Thank you.
Thanks for
Bye.
hosting, Chris. Thanks for the
Bye.
study.
See you next week. Cheers.
See you next week. Bye.
Cheers.
Hi.
Hello, Hannah.
Hello, Hannah. How you doing?
Good, thank you. You guys okay?
Yeah.
All right. Not bad.
Yeah.
Yeah. Are you frozen? Are you there? Oh,
Yes, frozen. Yeah.
me-
Can you unfreeze on there?